I would like to extend a warm thank you to the organizers for this invitation and the participants for the opportunity to present an update on Oculis pipeline to you today. My name is Marcia de Souza Lima, and I am the Chief Medical Officer at Oculis, an ophthalmology company. We are focused on creating the next generation topical ophthalmic treatments. Oculis was co-founded by two expert professors at the University of Iceland, and it is now incorporated in Lausanne, Switzerland, and managed by the experienced executive leadership team led by Riyad Sharif. Oculis has two clinical stage compounds in its pipeline. OCS-01 is based on a proprietary SNP formulation of high concentration dexamethasone, and it is currently being developed for post-ocular surgery, inflammation and pain, and retina, starting with diabetic macular edema. Two phase 2 trials have been completed, followed by a positive end of phase 2 meeting with the FDA, which allows us to move into phase 3 in both programs. The second compound, OCS-02, is a topical biologic, an anti-TNF alpha, being developed for anterior uveitis and dry eye disease. One phase 1 and two phase 2 proof of concept studies have already been completed successfully. In addition, we have multiple candidates in preclinical stage with a focus on ocular inflammation and angiogenesis. So what is the Oculis SNP formulation technology? SNP, or solubilizing nanoparticle formulation technology, was developed to overcome the main barriers for topical drug delivery to the eye, namely aqueous solubility, short contact time with the eye, transportation of a lipophilic drug through the tear film, and lastly, penetration into the eye. And how does SNP overcome these barriers? So SNP increases the drug solubility up to 100-fold in some drugs. It increases the residence time from a few minutes to several hours. And the technology does this by forming complexes between gamma-cyclodextrin, an oligosaccharide, and the drug. Gamma-cyclodextrin, which is hydrophilic, carries the lipophilic drug through the tear film and delivers it to the lipidic eye wall barriers where it can penetrate the tissues. The formation of these complexes promotes a high concentration gradient in the tear film and drives increased permeation of the drug through the cornea, conjunctiva, and sclera, and this gradient lasts for a prolonged period of time. These complexes carry the drug through the aqueous tear fluid where they are in constant dynamic equilibrium, keeping the tear fluid saturated with the drug. But because cyclodextrin is hydrophilic, it cannot go through the lipidic barrier of the eye wall, and it is then metabolized into glucose and maltose, which are natural sugars, and eliminated while the drug goes through the ocular tissues. So here are a few examples of the technology in action. On the left, OCS-01 was measuring the tear film after one drop and compared with the commercially available dexamethasone 0.1%. It was demonstrated that OCS-01 achieved much higher concentration and that was maintained above the competitor up to 6 hours. Similar results were obtained after a single eye drop with another drug, dorzolamide, this time with measurements in the aqueous humor of rabbits. The superior area under the curve is key because it allows for the reduction of dosing from 3 to 4 times a day to once a day for anterior segment indications and the ability to reach therapeutic effect in the retina, which has not been seen in retina with topical application. So this is the goal of the OCS-01 program. So let's move on to the OCS-01 program. So in the tear segment, our lead indication is inflammation and pain following ocular surgery. After cataract surgery, patients are typically treated with topical steroids and NSAIDs to reduce inflammation and pain. Despite many available treatments, a high unmet need still exists to improve convenience and compliance because the frequency of administration of these drugs is currently between 2 to 4 times a day with complicated tapering schedules. While the current trial is focused on inflammation and pain, there is also a plan for another program to prevent or treat cystoid macular edema, and OCS-01 will then be the only product with both indications. DX216 was the randomized double-masked phase 2 study designed to evaluate efficacy and safety of OCS-01 in the treatment of inflammation and pain following cataract surgery. OCS-01 once a day achieved zero inflammation at day 15 in 51% of the patients and zero pain in 73% of the patients on day 4, as you can see in the green box. Now, we also added the results of some key steroids in the market. So I want to highlight that these are different studies and the table does not represent a head-to-head comparison, but it gives us an idea of the drug effect obtained in this phase 2 trial in the context of the phase 3 results of marketed drugs. In this case, the drug fared very well, particularly when one considers the delta versus vehicle. We are in preparation for the phase 3 trials with the aim to prepare for market approval. In retina, our lead indication is diabetic macular edema or DME. DME is a leading cause of blindness in working age adults in most developed countries. However, only 41% of the diagnosed population are treated today in the developed world. In addition, the treatment burden is high as all available drugs are invasive, injected into the eye, and require frequent visits to the retina specialists. Thus, patients end up receiving a much lower number of intravitreal injections in the real world than in clinical trials, jeopardizing the treatment gains. DX211 was the randomized double-masked proof-of-concept phase 2 study designed to evaluate the efficacy and safety of OCS-01 in the treatment of diabetic macular edema. Patients received OCS-01 3 times a day or matching vehicle and were treated for 12 weeks. We included all comers, including patients with fairly good visual acuity, and I'll come back to that later. The FDA provided a device on this design, including the use of vehicle as the competitor arm. So these are the main results. OCS-01 had a compelling effect on central macular thickness with an early separation from vehicle and an increasing reduction of macular thickness up to week 12 when the drug was discontinued and central macular thickness had a dramatic return to almost baseline levels, suggesting a biologic effect. When we looked at best corrected visual acuity on the right, the separation between treatment arm and vehicle started early on and was maintained throughout the study. In a subgroup population, similar to what was done in other DME trials, such as Protocol T, we also see an increase in the drug effect in both central macular thickness and best corrected visual acuity in patients who had baseline visual acuity worse or equal to 65 letters. And in fact, at week 12, patients in the OCS-01 arm had larger letter gains and macular thickness reduction. We will therefore be incorporating this learning into the phase 3 trial design. We'll also include an induction period with a higher dose to help increase the therapeutic effect. From a safety perspective, OCS-01 was well tolerated and the safety profile is expected to be similar to other topical steroids. In summary, OCS-01 is an SNP formulation of a potent steroid with recognized efficacy and safety in both inflammation and pain following ocular surgery and DME indications. It is formulated as high concentration suspension, which is made possible by the use of the SNP technology. It has the potential to be the first once-a-day topical treatment for post-ocular surgery and the first topical treatment for diabetic macular edema. Lastly, it is a preservative-free formulation, which is a feature valued by ophthalmologists and patients. Other indications in both posterior and anterior segments of the eye, including cystoid macular edema, are feasible and desired by the community. Now on to the OCS-02, our second asset. OCS-02 is a first-in-class topical antibody fragment that inhibits the inflammatory cytokine TNF-alpha, which is a validated target in both the indications being pursued. The single-chain antibody fragments represent the smallest functional unit of an antibody, and they balance the specificity of an antibody with the bioavailability of a small molecule. They're small, 26 kilodaltons in OCS02 case, which allows for high concentration and efficient penetration through the cornea and conjunctiva. And achievement of the therapeutic levels in the anterior chamber, OCS02 has a full preclinical pharmacology and toxicology package and is currently in scale-up preparations for follow-up clinical studies. One of the proof of concept phase 2 studies evaluated the drug effect in patients with acute anterior uveitis, and the primary endpoint was on day 15. Patients were treated 8 times a day, and the dose was then halved to 4 times a day, starting on day 15. The treatment was then stopped on day 22nd. A steroid was added for masking purposes, but there was no planned comparison between these two arms. However, the inclusion of the steroid provided some interesting insights. While the typical steroid effect on inflammation was seen, we can also note that the effect waned as soon as the steroid started to be tapered on day 15, while the OCS2 effect continued to increase until day 29, even after the drug was halved on day 15 and stopped on day 22nd. In this trial, the responder rate reached 56% on day 15, and the primary endpoint was met. OCS02 was also evaluated in a proof of concept phase 2 trial in dry eye disease, which is now recognized as a multifactorial inflammatory disease of the ocular surface. The current prescription therapy options lack in efficacy and are generally not very well tolerated. This is particularly true for patients with severe dry eye disease who don't respond well to available therapies. So, the OCS02 proof of concept study focused on patients with severe dry eye who did not respond well to artificial tears and vehicle. In this population, selected for severe symptoms, patients demonstrated statistically significant improvement in a scale that measured both frequency and severity of symptoms. In this population, a portion of this population demonstrated an increased improvement of 20 points in this scale. When this high responder population was further analyzed as part of a pharmacogenetic substudy, a genetic biomarker was identified. This novel method of identifying high responders could allow for the first time a personalized approach to the treatment of dry eye disease. And this genetic biomarker will be evaluated in further studies. So in conclusion, OCS01 is a de-risk differentiated phase 3 asset. If approved, it will be the first steroid administered once a day for pain and inflammation post-ocular surgery. And it could be the first topical treatment for diabetic macular edema. OCS02 is a first-in-class agent in ophthalmology, an anti-TNF alpha, a validated target. OCS02 is being developed for 2 indications, anterior uveitis and dry eye disease. The emergence of a potential genetic biomarker could truly drive personalized treatment in dry eye disease, and a companion genetic test would facilitate identification of responders. Both programs have the potential to be expanded to additional indications, and most importantly, both have a clear path to market. The proprietary SNP formulation is also being developed for additional pipeline compounds to treat ocular inflammation and angiogenesis-related indications. Oculis offer multiple milestones within the next 1.5 to 3 years, and we'll be happy to continue the discussion after the presentation. Thank you very much for your time.